Welcome to the channel Nursing in Handy. This channel is preferably for the nursing fraternities to have a continuous learning in their profession. So today we will be seeing about occupational health and safety in context of nursing. So why we have to consider occupational health is, so when an employee is working in any institution or organization, the organization is accountable in providing the safety environment, that is safe working environment to all the employer in order to improve their physical as well as their mental status. So because every employee who is working in their work, they should ensure that our working place is safety, and there are some of any preventive measures has been taken by the institution in order to safeguard the physical and mental status of the employer. So there are various measures which is being carried out. So you can see in every organization, even in every hospitals or colleges, schools, in every institution we have a fire extinguisher. So why we have fire extinguisher? In order to prevent, if there any fire is being catched up in any organization, we can use those fire extinguisher in order to prevent a major trauma in the organization. So before occurrence of any incidents, there should be any measures to be taken by the institution to safeguard the employer. So all occupational fields have their own hazards. There are variety of hazards to which workers may be exposed and which may cause various disease. By following the proper guidelines and precautions, all occupational hazards can be minimized. So according to this, so we have to take some of the preventive measures and proper guidelines in order to safeguard each and every employer from occupational hazards. So definition: occupational health. It is a promotion and maintenance of the highest degree of physical, mental and social well-being of the workers in all occupations by World Health Organization. So according to Jogendra Vati, the definition of occupational safety is, it is a protection of employees from the occupational hazards. It is the health and well-being of people employed in a work environment. So occupational safety means when an individual is working in any organization, we have to provide a safe environment to the employer. So safe environment in the sense the physical and the mental status of the individual has to be maintained and improved. Next is occupational hazard. So according to Jogendra Vati, a hazard is a potential source of harm, substance, event or circumstances can constitute hazards when their nature would allow them even just theoretically to cause damage to the health. So next we will be seeing about aims and objectives of occupational health and safety. So to promote and maintain the highest degree of physical, social and mental well-being of employees, to reduce the injuries, accidents, infections or absenteeism due to the poor working environment, and to protect the employees in their employment from risk of occupational health hazard. So next we will see what are the occupational hazards. So we have physical, chemical occupational hazards, biological, mechanical and psychosocial occupational hazards. So we will be seeing each and every hazards, the examples in forthcoming slide. So physical is, any individual is working in extreme heat, cold, light, noise, vibration or UV rays. The chemical occupational hazards are inhalation, ingestion of any chemical substances in any factory. Next is biological, which comprises of bacteria, virus, fungi, parasites and protozoan, especially the medical professions. And mechanical is accidents. Psychosocial is frustration, insecurity of the job. So next we'll see about the physical hazards. So any person who is working in a working place which contains extreme heat that cause burns, heat exhaustion, heat stroke, heat cramps and increased fatigue. So who and all will work in extreme heat is like in the construction workers or farmers who is being exposed to the sunlight for a very long period of time, or anyone who is working in extreme cold, he may cause trench foot, frostbite, hypothermia. And next is extreme light that causes headache, eye pain, minus nystagmus and visual fatigue. And next is pressure that causes a Caissen's disease, air embolism and blast. So next is ultraviolet radiation, which consists of conjunctivitis, keratitis, that is welder's flash, redness of eyes and pains. So ionizing radiations is genetic changes may occur in the individual, malformations, even cancer and leukemia, ulceration and sterility problems. So you can see that the noise which causes sometimes a temporary to permanent hearing loss. So these all are the physical hazards which takes place in the working environment. So for example, the ionizing radiations, like being in any factories which produces more amount of ionizing radiations, these all the health hazards can take place. So this is a image of the trench fruit who was working in a cold area for a very long period of time. Next is frostbite, again in extreme cold, and conjunctivitis or keratitis due to the welder's flash. Next is chemical hazards, which contains the inhalation and ingestion of the gases, that is poisoning gases like carbon monoxide, as anesthetic gases like ether and chloroform, and dust, inorganic gases. The coal dust, that condition is anthracosis, silica which causes silicosis, asbestos which causes asbestosis, and organic dust like cane fiber, which is condition is called bagasosis, cotton dust is bisonosis, hay or grain dust causes farmer's lung. Metal and their compounds can also cause toxicity in the individual, that is toxic hazard from lead, mercury, cadmium, manganese, beryllium, arsenic, chromium and etc. So these all are the chemical hazards. Next is biological hazards. That means especially our medical profession. So nursing or the health individuals who have a direct contact with the biological hazards, that is brucellosis, leptospirosis, anthrax, tetanus, and occupational cancers, cancer of skin, lungs and bladder, and occupational dermatitis which causes dermatitis and eczema. So these all are the biological hazards. So for each and every hazard we have to follow the preventive measures and precautionary measures in order to prevent the occurrence of those hazards in our working place. Next is psychosocial hazards, that is frustration, loss of job satisfaction, insecurity in the job, poor human relationships, emotional tensions, depression, sickness. So due to these all conditions, we also have a regular absenteeism, peptic ulcer, rapid aging and heart disease. So nowadays we can see, so many of them are having the heart defect due to the extreme depression and stress. So we have to provide a working environment to be safe. Next is measures of health promotion of workers. So according to ILO recommendation, every organization or institution should have these following criteria in order to promote the physical and emotional status of the individual. So the working place should contain a proper nutrition, prevention control of communicable disease. So some of the measures to be taken by the institution to prevent control the communicable diseases. Environmental sanitation should be maintained, water supply should be there, provision of food and snacks should be there, that is provision of canteens, toilet facility should be there for separate male and female, general plant cleanliness should be maintained, floor space and air space, that is for each individual there should be at least 500 cubic feet. Wastage and garbage disposable, that is the disposal of the waste should have a proper treatment and proper disposal of the garbage should be maintained. So these all are the ILO recommendation to have these all the criteria have to be followed by each and every institution to safeguard the physical health and also the mental health of the person. So next is adequate lighting and ventilation should be there, protection from hazards should be maintained, housing, maternity benefit should be given to the women, first aid treatment in case of any injury have been occurred, crutches facility should be there. If a woman is more than 30 members are working in an institution, the crutch facility should be maintained, family planning measures, mental health and health education. So family planning measures, like in any hospitals, if a nurse or any healthcare professionals are working, we can give them maternity benefit scheme and also the measures taken to do the family planning schemes like that. Next is prevention of occupational disease. So some of the measures we can take is, one is medical measures, second is engineering measures, and third is legislative measures. So legislative measures in the sense the government are also taking some of the measures to safeguard the working environment of the employer. So in the recent times what happens, the news also they have said, like the persons who are working in the extreme heat and all, we have to provide break in between. So that all the some of the measures taken by the government. So medical measures is pre-placement examination. So before recruitment of any individual, we have to conduct a pre-placement medical examination, and periodical examination should be done in order to promote the health of the individual. Medical and healthcare services should be available in the institution. Supervision of working environment. So there should be a supervisor who has to supervise the working environment for any hazard or any insafety is being there in the workplace. Next is health education and counseling. So health education and counseling regarding the medical issues. So if they have any health conditions, they have to priorly inform the supervisor regarding the health condition, so that the prompt treatment can be taken. And also these all are the medical measures which has been followed in most of the institution. That is, pre-placement examination is done, that is medical fitness we are asking from the employees for their health status. Next is engineering measures. So whenever the employees is working in the institution, some of the engineering measures has to be taken by the institution, because they are the person who is accountable for the physical safety of the persons. So design of building should be appropriate counseling should be done, and enclosure of an isolation should be there for any emergency situations. Housekeeping facility should contain. Next is the Factories Act 1948. The Factories Act and ESI Act has been amended in order to safeguard the physical and emotional well-being of the employer. So Factories Act, which says that the cleanliness, lighting, ventilation, treatment of waste, effluents, disposable. So these all are some of the measures. That is, supply of safe drinking water should be there. Employment of cleaners should be there in every institution. Another recommendation which include, there should be a 500 cubic feet space for each worker in order to have distancing and isolation. Precaution regarding the safety of the worker should be there. Specific welfare measures like washing facilities, facilities for drying, storing, facilities for shifting, sitting, first aid, restroom facility should be there. Lunchroom should be separate for the workers, canteens and crutches facilities. For each and every 500 employees, there should be a welfare officer. For every 200 workers, there should be a canteen. And if a woman, that is about 30 members are working in any institution, there should be a crutch facility that has to be implemented in every organization to have the crutch facilities for the women to have in-rooming of their babies along with their work, depending upon the situation of the work and the criteria of the work. Next is employment of children. That is, the Act prohibits employment of children below the age of 14 years. So from 15 to 18 years for the adolescent age group, they should have a fitness certificate from the surgeon, and also they should work between 6 a.m. to 7 p.m. only. And the Act prohibits employment of women and children in dangerous occupations. So they have some of the criteria. So in all that occupations, these children and women should not be inculcated. Next, the hours of work is about 48 hours per week they can work, but it should not get exceeded, and 9 hours per day they can work, but there should be a break should be given for the work if they are having a continuous work. Next is personal protection, physical hazards, like there will be a radiation exposure, back injuries to the individual for long standing works, burns due to steam sterilizing. So for that purpose and all, we have to provide a protection. So in biological hazards, like we are going to, as a nurses, we are going to deal directly with the bacterial infections, viral infections, protozoan infections. So in order to safeguard us, we have to wear the personal protective equipment like gowning, gloving. So the one of the very good example is like when we as a nurses working in the COVID era. So what happens, we, in order to protect ourselves, so when we protect ourselves only, we can go and give the nursing care to the persons who are in need. So we have to protect ourselves. That is known as occupational safety. Next is psychological hazards. By providing a conducive organizational climate, clear the priorities and directions, continuing education should be there, a proper feedback from the persons regarding their workplace, so that they will, if they have any grievances or complaint, that can be rectified. Support with the counseling services if they feel the working place is giving them more of depression or any frustration, that can be sought out by the higher authority who is working in the institution, like supervisors or safety officers. Next is patient protection. In the sense of nursing, nosocomial infection control can be prevented. So once they are into the hospitals, there is a chance of getting the opportunistic infections from other patients. So in order to prevent that, we have to use the sterilium for each and every patient to prevent those nosocomial infections among the patients from the healthcare settings. So next is about the patient safety. So keeping the bed rails up. So in order to prevent the fall, we have to provide side rails. Bathroom and toilet aids, particularly for the elderly and disabled, should be there. Walking aids for the disabled, and during the recovery period there should be a walking crutches should be provided. So food safety, like food storage, handling and preparation with highest standard should be there. So next is a occupational health nurse. So occupational health nurse is one who is a registered nurse who independently observe and assess the workers' health status and to respect them from job task and hazard. So the occupational health nurse will observe is there any hazard is there for the nursing personnel who is working in the hospital, and also she will assess the hazardous things, and also she will make some of the preventive measures in order to prevent the trauma in the future terms. And the main intention is to provide a atraumatic environment for each and every individual in the hospital. So role of occupational health nurses, like she will be acting as a clinician by adopting a primary prevention strategies. Emergency care will be provided. Treatment services, in case of any emergency situation, the nurse will have a triage system of care. Next is nursing diagnosis, that is a proper assessment of the patient regarding and framing out the nursing diagnosis based on the priorities. Individual and group care plan will be adopted. General health advice and assessment will be given. So specialist in the sense she will have a practice development, implementation, evaluation, occupational health assessment. For periodically she will do the health assessment. Health surveillance will be done. Sickness absence management, for example, if nursing personnel is being absent for a very long period of time, she will also inquire about those conditions. Next, as a manager, the management works like administration, budget planning. Even for the occupational health works, we have to plan the budget. Quality assurance in the sense of rendering the quality care. So coordinator, she will get a collaborative work by coordinating with other healthcare personnel in developing the atraumatic environment for each and every individual in the healthcare settings. So and also doing the evidence-based nursing practices and research skills in order to improve the physical and emotional status of the employer working in the institution. So occupational disease should not be neglected, should give proper attention at time. It is a main role of a nurse to work as an educator and protector in the field of occupation. Early detection and timely management can control the occupational disease. So these all about the occupational health and occupational hazard, and how we have to overcome from this occupational hazard. So we have seen about the definitions. So what are the occupational hazards we are coming across, and what are the measures has to be taken, like physical hazards, biological hazards, chemical hazards and psychological hazards. Some of the promotive measures and preventive measures has to be taken by the institution, because they are in a position and they are the accountable person to provide a atraumatic environment to the individual. So that's all for today's topic. If you have any doubt, kindly drop down in the comment box. Kindly subscribe it, like it, and watch and share among your friends, and have a continuous learning in your profession. Thank you for watching.